And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hey, welcome to Keeping It 100, where we have these open and honest, super honest conversations to make sure you have all the information you need to make better health decisions. I am your host, Dr. Kristin Motley, and of course, we have a really good show for you today. Now, if you think of questions, you want to make comments, please do so. Pop them in the chat. My friend and colleague, Dr. Tyan Thomas, is managing the chat. She is going to respond and make sure all your questions get answered. So let's just go ahead and get started. We've got a lot to talk about. I want to welcome in my host, Mr. Street Practitioner himself, Georgie Mink Jr. Hey, Jay. Come on off mute.
I know, right? Good afternoon, Doc. Good afternoon.
How you doing?
All right. What's going on?
It's been a crazy week. I don't know if we even had a meet. Like, we usually meet every morning. I don't know if we even had a meeting this week. I don't know.
It's just been your type of summer. It's all right. We're gonna get it together.
Oh man, this has just been crazy summer. So, but I know you've been working. So we haven't been meeting, but I know you've been in the street. So anything new, like where you've been, what's going on? I know we did Making a Change group event this weekend. That was fun.
Oh yeah, very, very nice event. Shout out to Making a Change group, Corey, Tiffany, everybody that was a part of that day. Wonderful day for the city. Great energy.
Yep.
Talked to a lot of people, kids. Like we just had a nice time. Parents. Shout out to Francis. He's the MVP for us.
Yes.
Had a nice time. Really had a nice time. I wasn't that aware that how many kids know about the vaccination, and they really had opinions on them. So it was just like, wow, okay.
Yeah, so one of our interns, Ashley Joseph, she's a pharmacy student. She created an activity for the kids to play to test their knowledge on the COVID vaccine. So we typically, when we're doing a kids event, we had the kids come up and we test their knowledge, give them a little quiz, and then they get to pick from the toy bin. I'd be like, all right, y'all take one. And they'd be like, I'm going to just put my whole hand and take whatever come out my whole hand. But, it's all good because we love the kids. So
yeah. It was nice though. It was nice. It really was.
It always is. Have you been to any barbershops this week?
Oh yeah. I've been to Trademark in Collindale. Good brothers in there.
Nice.
They know the importance of being vaccinated. I got a lot of questions about the upcoming winter. Like, what should be our next move, for the people that are vaccinated and boosted? Like, and I told them, I always say Doc says. So that's like we might have to start adding that on the segment, like a Doc said. Doc said, so Doc said, the next one, the booster is the one that's going to help us defend it, defend the COVID and whatever the variant, whatever is going on at that time, whichever cousin it is, we don't know.
We still dealing with Omicron. Omicron is still out in these streets. And so what the drug makers did, Pfizer and Moderna, they went back in the lab and they made a vaccine specific to Omicron. So was reading that that'll be available in September. So if you've been vaccinated, if you've gotten at least 2 doses, if you've gotten a booster, or if you haven't gotten a booster, you are going to need to get the Omicron specific vaccine this fall, because that's what's in circulation now. The problem with COVID is that it is trying to outsmart us. It is beating us. It's trying to survive. So it changes its costume. And when it changes its costume, it makes the vaccines not work as well, because the drug makers, they make the vaccine according to what is out and what's in circulation, because you can't predict what the virus is going to do. So right now, Omicron has been like running these streets. You know, we had a high peaks during December, January, February, came down a little. Now it's going back up again. So it's still in circulation now. So that's what we're going to be getting this fall. Now, what could happen is that the virus could change again, and they're going to have to go back into the lab, because when the vaccine isn't working well enough to keep people out of the hospital, to keep them from dying, and we're in trouble. The good thing is that the original vaccine they came up with before any of these mutations or variants came out are still doing a good job keeping people from dying and keeping them out of the hospital. That is crucial. That was the goal. The goal was never to keep you from getting sick. It was never to keep you from spreading it. It was getting these people out of the hospital, or preventing them from having to go to the hospital, straining the healthcare system, and preventing them from dying. That was the goal since day one. It's still doing that. But with the Omicron specific booster that we'll get this fall, that will probably help people not get as sick, because it sucks to get COVID. Like, it sucks to be vaccinated, get COVID, and still get sick. But that's what's happening, because the vaccine that we got is not protecting as much against Omicron, because it didn't exist when the vaccine became available. So we're like always chasing it. So hopefully when we get Omicron vaccine, if that's the variant that's still in circulation, you'll see less people get sick and less transmission, hopefully. But as long as it's keeping us from dying and going to the hospital, like, I'm good with that.
Yeah, I mean, like I said, that's where a lot of energy been coming from, like in that area with people that's vaccinated, they were scared, or not scared, but just wanted to know, you know. So I pretty much gave them that information. So that's great, Doc. I mean, we got to get ready. I mean, it's summer's getting ready to end. Yeah. We got school kicking in. We got wintertime coming in soon. You coming fresh off of COVID, your whole household.
It's too much.
And it's going up. I mean, like the numbers are going, like, they're static, like they're out the roof.
They are crazy now. I was talking to someone today, and they was like, Delaware about to go on lockdown. I was like, what? She said, You don't watch the news? I was like, no. She said, Delaware about to go on a whole lockdown. So I'm out. Need to go get my essentials and go sit down somewhere.
Right.
I don't know. So I need to turn the news on and see what's happening there, because I have no idea about that. But yeah, it is a lot. You know, Biden was negative. He had COVID, like around the same time I had COVID. He tested negative, then he went back positive. I got a scammer around here. But and I know that was causing a lot of confusion. Like, did he get it twice, or what happened with Biden? So I wanted to touch on that real quick. So I don't know what happened. I don't think he caught it twice. I think because he was taking the antiviral Paxlovid that people take if they are high risk of dying or really, really getting sick. Hey, Nolan, we miss you. I ain't seen you in so long.
What's up,
Welcome back, Nolan. So when Biden was taking the antiviral Paxlovid because he was high risk of dying or going to the hospital from COVID because of his age, and he may have some other health conditions. So he took that. And what we're seeing is that there's a rebound COVID that happens when you stop taking it. It's not a new infection. It's just a virus re-emerging. And so that's probably what happened with him, because he takes the medication, it cuts the virus down, but then when you stop taking it, if the virus isn't all the way going, it may start replicating again. And so you end up testing positive again. We don't know if that means he's contagious or what, but it was highly likely that it was not a new infection. It was just the same infection that just re-emerged because he stopped taking that medicine. So they're still looking at that. I thought that we had rebound COVID cases in my household, because we had COVID 2 weeks ago, and then we isolated 10 whole days. Bria went to camp on Monday, and then she came home and she was like, I got a headache and my sore throat and my eyes hurt, and I'm taking her temperature, and I feel like her temperature was a little high. I was like, what on earth is happening? Is the girl getting COVID again? So she ended up testing negative. I had her tested, so that wasn't COVID. She must have picked up something else. But I was like scared. It's just COVID has been wearing me out, taking all my energy. And I just can't. I'm just over it. So people, this is what I'm going to tell y'all. Y'all test positive for COVID. Please isolate for 5 days. Stay home for 5 days. Stay away from people for 5 days. This is what the CDC recommend. And if you got to go out after that 5 days, go back to work or whatever, just wear a mask. A lot of times what happens is that people feel like, oh, I'm better. I'm good. I don't feel sick anymore. And so they're out and about and you are spreading it. You are still contagious. There's a lot of studies that show you are still contagious after 5 days. I haven't seen the longest period that people have been contagious, but after 5 days, you are still contagious. So don't just think because you're feeling better, you don't have no symptoms, you could just be out and about without a mask on. Please wear your mask. This is not about you. This is about all of us. We all have to protect each other. And so I want us to just do as much as we can to keep each other protected. If you have to go out after that 5 days, it's all good. Just wear a good mask, not just like a bandana, not a cloth mask. Try to get a surgical mask, an N95, KN95. We hand out masks at all of our events. We hand out a surgical mask. So if you see us out and you need some, come get as many as you need because we want to make sure we are protecting our community. So I'm done. I'm off my soapbox. I'm just done. I'm just tired. I'm tired. TIED. I am tired.
Right.
I just can't do it.
Right. But I mean, it's like, it sounds like so repetitious, but it's the truth. We're going to say it every week. It's not going anywhere. We said that from the beginning. So we have to get used to it. The same way, COVID is getting comfortable and, in society, we have to be able to defend it. So that's basically what our message is every week. We're seeing the numbers rising. Like you said, it's based off the type of variant. So it got stronger and it knows how to infiltrate our body and go around the last vaccination or the last booster. So it's stronger and you're going to get sick if you're not prepared with the next booster that's being set up. So they still been working on this thing since they came up with the first vaccination to keep going along with the disease or the virus or whatever. So we got to trust the process.
Trust the process.
Yeah.
What a wise man once said.
Yeah.
Process. So today I wanted to bring in a special guest, none other than Mr. Bilal Motley. We've been having a little COVID vaccine battle.
The Mr. in the building.
I was like, yo, why you got the headphone on? I don't even have a headphone.
What's up, Bilal? What's going
on, George?
What's going on?
How you doing?
So we wanted to have you on just to, hear so that people can hear how parents are making decisions about getting their child vaccinated. Children will be going back to school soon. We ain't dealing with no shutdowns. These kids need to be in the classroom. We need teachers in the classroom. We need to protect the whole village. And so the vaccines are available for kids as young as 6 months, but a lot of people are not getting their kids vaccinated. And I'm holding my hand up because I have a 2.5-year-old and he hasn't been vaccinated yet. And I know we talk about this a lot. And, I just feel like I just want to wait and just see what happens. I mean, and this was before he got COVID. So I was like waiting and you were like, well, what if he ended up getting COVID and he's not vaccinated? So we went through all that. And now I feel like I got even more time because now he got COVID. He had COVID. He's protected some. But now I'm like, I don't even know how protected he really is. So I'm just struggling. But let's hear your take on this, Mr. Motley. How do you feel about getting Noah vaccinated?
Well, hello, everyone. Thanks for having me on. I guess I got to say that. So, I was weighing that before Noah had COVID recently. I was weighing what if it went way left when he eventually did get COVID? And I'd rather him be protected. But Kristin, I did understand your concerns. You wanted to see a certain threshold met around the country and the world with the vaccine for the kids to make sure it's safe and things like that. So it was really tough. And it was a debate in our house about what to do. Like Noah has been through so much already with his health and it's really interesting the decisions that parents were having to make. So I felt like he should have. Yes, I was for him doing it because I'd rather him have it, You know what I mean? And I trust the science. And I understand there's some people that don't, you know, and we know why. Like, people don't trust the science or whatever. They don't trust the government or these companies that are out for profit or whatever they say. But I do trust the scientists because, like, Doc, like you told me at the crib, you know, there's a lot of people that look like us that are working on this stuff. We know people personally, our friends that are working on these clinical trials. So things are different than back in the day. So yeah, I'm for Noah getting it. I'd rather him have it, be safe. I trust the science. And yeah, but I do understand the people that don't. So we got to find a way to, you know what I mean? Like, there has to be a way to bridge that gap. And that's what this shows like this is for. You know what I'm saying? Like, just getting that information out there from trusted faces like George and Doc. Yeah.
Right. So one thing, Bilal, like, even before I guess the question came up with Noah and the kids, what was your initial feeling? Like, you know how we get down, how brothers, how we think.
Right.
You know, you educated, but you still have your own way of thinking. So as far as when it first went down, did you have any hesitancy at all? Like, as far as when the vaccination first came out, even when it was like whispers in it before it even came all the way out? Because you know that's what it was boiling up to. It was boiling to the vaccination. So even before it came out, what was your personal like feeling?
So when the pandemic started, I'm an essential worker. I was working at Drexel and I ran all their facilities and I ran my own campus next to City Hall, the Center City campus. So I was around and I'm a different case. I was around like a lot of doctors, and obviously I live with Kristin. And Kristin, I call her little Dr. Fauci, you know, the notorious Fauci. You know what I'm saying?
I like that, Lil. I'm gonna use that.
You know what I'm saying? The notorious Fauci. She home spitting facts. She got charts in home.
Right.
So
okay.
I kind of had a cheat code. You know what I mean? Because I had the information at home, and honestly, I wanted to be safe because I work mostly with you know, like I work with a lot of unions and contractors, and some, not all, but some had their own opinions. They didn't want to wear a mask when the pandemic started, so they all in my face, like, "Hey, what do you think about the flu?" Like, yo, man, you better get out of here, bro. So I was trying to be safe, man. You know what I mean? Because I need to be around for the Eagles to win the next Super Bowl. So you know what I'm saying? I don't know when that's going to happen, but I need to be here for that. You know what I mean? And obviously for my family and myself.
Thank you.
So sorry, I had to throw that.
Yeah.
But
y'all in there somewhere. Yeah.
So it was I had a sort of a cheat code just living with Kristin. But I wondered if I wasn't with her and I was by myself. I don't know, because I grew up. My dad, you know what I mean? He had that little arrogance, man. We don't get sick. You know what I'm saying? Like, it was that little swag. Like, we don't get sick.
We don't even get colds.
Exactly. Put a little tussin on that, John. You know what I'm saying? You gonna be all right. You know what I'm saying? That old school way of thinking. So if I wasn't with Kristin, I don't think I would have got it, because I never got the flu shot until I was with her. I was like, man, I don't need no flu shot. I'm from Chester. Come on. You know what I'm saying? Like, I don't need no flu shot. You know what I mean?
We don't do anything. We can make it do anything. What?
Yeah, man. You know what I'm saying? So yeah, if I wasn't with her, I don't think I would have got it.
Wow.
Unless, and a lot of people are in this boat, unless your job made you, and my job made us get it. It was like low key. Suge Knight. They kind of was like, if you want to keep working here, you don't need to get this. So it was like they didn't say it, but it was like, look, or they did it so you had to get tested. Oh, we're gonna test you like every day. You know what I mean? If you don't want to get it. So nobody want to be tested every day. That's going to interrupt my Netflix at work. You know what I'm saying? Like, I can't be having that. You know what I'm saying? Allegedly, Drexel. So
okay,
I throw that in there. But you know what I mean? Yeah. So if I wasn't with her, I don't think I would have got it. Because I had that arrogant mindset, man. Because I never get sick.
Right.
Getting the flu shot was a big deal for me. I was like, well, why would I inject the flu? The flu, because the way it works, right, Chris, you inject the flu inside of you to protect you. I was like, why would I do that?
That's not how it works. I never told you that.
Oh, my bad. I saw that on Wikipedia.
Oh my god.
My bad. So, whatever. I saw it on Wikipedia.
He saw that somewhere. Okay, now you're going to set it up.
They do not inject the flu to give anybody a flu shot. What they do is they inject an inactivated version of the flu. It's like a dead flu. It's not live flu. It's like a dead version of the flu shot to make your body make the antibodies. It's the same way that the COVID vaccine, well, it's not the same, it's similar. So instead of injecting you with a dead version of the coronavirus, what they do is they just tell your body to make the antibody. So they don't have to inject the disease in you or like a dead version of the disease in you. They just inject the vaccine, which tells your body make the antibodies against this virus. So that's how vaccines work. Just telling your body to make the antibody so that when you're really coming up against it, you had a protection that you need.
So Chris, so when you explained that to me like 10 years ago or whatever, I don't have 12 degrees like you. So I processed that through the east side of Chester in my brain. It was like, it sounds like I'm getting the flu.
Yeah, so you're giving me the flu, right? You're giving me the flu, and yeah, so that's why I can fight it better when I really get it. Okay.
Oh gosh, I gotta do better. I'm gonna get better at my teaching.
But now, so all right, so okay, fine. So we want to bring everything up to date. We already know like of the COVID episode in the Motley household. Yeah. So, like, as far as like as a parent, now I'm talking to you as a parent. Like you already was pretty much for it, but I mean, I know it had to like upset you, and it also had to, especially since Noah is going back. Like, first of all, I guess this was his first year in daycare, right?
No, baby, yeah.
Well, he just went to daycare. He was already sick before COVID and then got COVID. Yeah. So I'm basically with you now. I feel like it's like 2 against 1. So I'm thinking we probably just need to take Noah after we get off the show.
Right.
Who's going to take
exactly.
what I want now?
Exactly. But to get back to the question though, like so you fully invested into the process of the vaccination. Like for your family, your children, even Bree, like, you know, your oldest. So it's just like,
right.
You know, like, so you're pretty much there. Like, it's no questions.
Yeah, because the reason why, and I told Kristin this when we got this, like, who knows what would have happened? Like, I had like mild symptoms. I had an annoying cough. You know what I'm saying? My throat was a little funny. You know what I mean? But, you know, I ain't been to the gym since the first Iraq war. You know what I'm saying? So I'm like, I don't know what would have happened if I didn't have a vaccine. You know what I'm saying? Like, you know what I mean? I ain't been working out like that. Like, I'm not in the best shape right now. So who knows what would have happened? I'm not, you know what I mean? I'm not taking care of myself that well. You know what I mean? And it's, I don't know. It would have, I'm thinking we'll never know this. It could have been way worse. Definitely. You know what I mean? Because I was good. My temperature went up to like 100. I took you know what I mean? Took quick medicine.
I was like, oh, my temperature 100.
Yeah, because Kristin was like, Chris was like, yeah, see what happens if you get up to 102. I was like, nope, I'm at 100. Give me that medicine. I'm good. And I never went above that. I was like, I'm chilling. So this could have went way left. So I'm glad I had this, you know, and I'm not paid by Pfizer or nobody. Like, I'm just going off. This is me speaking to y'all. Like, I know the audience is mostly Philly, Delaware County, and larger. Like, I'm speaking to y'all. Like, this, I'm glad I had this because this could have went way left. And I was good. You know, I was back break dancing. You know what I'm saying? Like, I was good. I just had a few days where I felt
right. I know, bro. You know how we shake stuff off. It's like Pop said. You know what I'm talking about?
Exactly. I was like, man, that COVID ain't nothing. You know what I'm saying? But it was really, I'm thinking it was really the vaccine. Like, when I realized I got it, I saw that message. You know what I mean? You start getting, you like the pulled Smokey on Friday. You like, you know what I'm saying? Like, I started feeling weird immediately. As soon as I started feeling that, as soon as I got that, saw that email. And so I think this could have went way left. And I'm glad I did have it. So yeah, that's just me. Like, I ain't forcing nobody to do nothing, but for me personally, I don't know what would have happened.
Right.
You know? Yeah.
That's great. That's great. So Doc, you gotta chime in. You gotta chime in, little Fouch. You gotta chime in.
I'm just glad that he made the decision for himself. So I mean, that's what all of our work is about. He got vaccinated before I got vaccinated. I was like, I ain't ready yet. So I'm just glad that he made the decision for himself. And that's what this show is about. It's about providing information so people can make decisions for themselves. It's not us ever telling you what to do. It may sound like that, but in our heart, we want you to make the decision because there is going to be something else that's happening. I mean, like, look at monkeypox, and we're going to try to do a show on that. next week, but it's like it's always going to be something, and we need to know how to find information so that we can make good decisions. And we can't just like believe everything and anything we see or hear or read. We can't go by how we feel the entire time. We have to be able to know where to go to, who to talk to, so that we can make good health decisions, and we can stop all the, well, but Black people die at twice the rate, and Black people this and Black, and like we always get the worst of everything. We have to learn how to make good health decisions. The information is there. It just takes a process on knowing who to talk to, who to trust, and how to get the information and make decisions for ourselves. So I'm just proud that he made a decision on his own, because he was on board before I was on board.
Right.
It took me a while to get there. So I know it's not easy. It's not easy. But I want to just mention something that Nolan said about him telling his cousins not to get vaccinated, and he was watching, it looks like a film or something he was watching. The only thing, I'm not familiar with the film or the organization, but I would just say to everybody, know what you're taking in, because anybody can put anything on the internet. Anybody could make a movie, a film about anything. People, it's you just have to know the group, know the people, know the intentions behind people that are doing stuff and why they're doing it, who it's benefiting. A lot of times we see that diseases and things affect the Black community worse than it does other communities. And I wonder, is that how certain people want it? And do they push out information to get to our people to keep our numbers looking bad and hurting our community? And they know our community is going to eat it right up. Oh, they're going to eat it right up, because it's going to make sense. And, we're going to, tell this information, and it's going to sound so perfect, and it's going to make so much sense. They're going to eat it right up. And then look at us, still the number one people dying of COVID. And right. it's just, we have to protect our energy. We have to make sure we're putting stuff in front of us that, we know where it came from. It's been vetted. It's not just something that people put together to create a good story. We just have to be careful about that. Dr. Thomas, did you want to add anything?
Yeah, I was going to ask Tyan to chime in too.
Mm-hmm. She might.
Can she hear us?
She might be on double duty. I know she.
Okay.
She be busy with the kids and everything. But yeah, so just really making sure we're getting information from the right places. And it's hard to do that because fake news spreads quickly. As you can see on social media, fake news just, spreads super fast. Oh, her mic's not working. So it's just, we just have to be careful. We just cannot believe everything you see on the internet. And you have to have trusted people that you can contact and reach out to that has quality information, not just garbage.
Right.
I'm not saying that's what Nolan is doing at all. I'm just speaking in general because I'm not familiar with that organization, so I don't know.
Right. But we're really not going to go too crazy into the monkeypox, but I'm like curious, like what's your take on it, bro? Here we go with another one.
I know.
We 2 years and this thing look crazy. So like I don't really, it might start turning you into a monkey, bro. You're gonna wake up and y'all gonna be having hands.
I don't know. This has been because we're all trying to, because as humans we're all trying to like move on, and I get it. I'm trying to move on. You know what I mean? These variants, like move on, like you know what I'm saying,
I'm
like
joking,
just get my life out, get my life back, because I'm an extrovert. Kristin can stay in the crib forever and be happy.
Right, good.
I gotta get out there. You know what I'm saying? So
I'm like you, Lam. Yeah.
So yeah, George, it's just like another thing, and it's just like we got to stop and pause and be like, we're going through something. Like these last 3 years have been difficult. Like it started with Kobe, who I played, I was a freshman, he was a senior, but I played against him in high school or Chester High School. We played against him,
right? And
like started with that, then the pandemic, and then going to work, and you know what I'm saying. It was just this is just never ending. It's not a monkeypox thing,
right?
I don't know, man. I don't even know what to say about that, but I know we just all got to watch our mental health, because like some jobs, like I still got to come into work and deal with all this stuff.
Oh yeah,
and I'm in charge of like the facilities at this nonprofit. So the cleaning, so they're heavy on cleaning. Oh, we have high touch service to clean all the services. So I'm uniquely, you know what I mean, tied to all of this. You know, making sure keeping COVID away from our patients at this nonprofit. You know what I mean? So yeah, it's just a mental drain, and it's just another thing. You know what I mean? I know we want to move on, and it's really tough.
Right. Yeah. So I mean, that's what I've been getting, Doc, when I've been out there. Like, brothers ready to talk about that, and I'm just like, I mean, we have to start talking about it because it's coming. It's coming. Like,
it is, and I think we got to stay ahead of it and try to do what we didn't do for COVID, like get the information out there to the people as early as possible, so that it's not, you know, people aren't just wondering. So I sent a few texts out. I reached out to a few people to see if I can get some experts to come on and talk to our viewers next week about monkeypox, because, you know, it's here, so we need to protect ourselves. It's not just a thing that happens in the LGBTQ community. It's not an STD. It's spread by touch. And so, you know, it's a lot of information that we need to, you know, to share with the community so we can stay protected. Just like we know that we need to wear masks for COVID and wash and sanitize our hands. There are some things like that we need to do preventively to protect ourselves. And then what happens if you do get monkeypox? And then what's the next step? There is a vaccine available for it, which is great. But it's in limited supply right now because nobody was expecting a monkeypox outbreak. So the national stockpile, you know, has some, but they're distributing it according to who needs it the most, which states need it the most. And so it's just being, you know, distributed like that, but we don't have enough doses for everyone that's going to need it. And so right now we just need to prevent, you know, spread as much as possible, and then try to get people that do test positive or who think they have it to the doctors, and getting the doctors to make sure that they can have the testing capabilities so that they can test on site. And then if they do, providing the patients with the treatment or with the vaccine, whatever they need to, you know, prevent it from being a thing like COVID. So, and I don't expect it to get as big as COVID, because COVID just spreads so easily by talking to people. Monkeypox doesn't spread that easily that way. Like, you really have to have contact with someone, like touching them is the most efficient way that the virus is spread. But we'll talk about that some next week. I know we're at time. Thanks, Mr. Motley, for your time today. We appreciate
you. Lyle. Get Noah ready.
Yeah.
We'll get no address.
Get no address.
Before we go, I do want to give a shout out. I do want to give a shout out to Mr. Motley and his daughter, Bria Motley. Our daughter, Bria Motley. They have a film, Quarantine Kids, which is premiering at the Black Star Film Festival tomorrow.
Check in.
So y'all can go to blackstarfest.org.
Yeah, blackstarfest.org.
Can you put it in the chat, Doc?
Yeah. Tell us about the film real quick. Lil, you got 30 seconds.
It was like you got 2 minutes, bro. Go.
Okay. It's a film that I co-directed with my daughter, Bria, who was 9 at the time. It's basically about her pandemic experience and how difficult it was. And and I think it's a universal story. I think kids around the world are going to feel this. I think parents are going to feel this. I think anybody can feel this. And she tells, at 9 years old, she tells a story with a full story arc, and it's just a beautiful story. It's funny, it's heartbreaking, and I think it's something the world's gonna love. So yeah, Quarantine Kids premieres tomorrow, 11 a.m. Go to blackstarfest.org. So it's gonna be nice. I'm doing this all for Chester, so Chester, PA. You know what I'm saying? Trying to put on for my city. So put on for the city. So everything I do is for Chester, for everybody there. So that's it.
Appreciate it, bro. I'm gonna check in, definitely.
Thanks, bro.
Thanks, y'all. And again, I can't find my hotline phone, so if y'all need me, I did start an IG, so y'all can DM me at what's my IG? The Doc
is on the ball.
My bad. I'm sorry. Doc is on the ball. DM me. I do have my login. DM me. Doc is on the ball. I can answer your questions there. I'm going to find my hotline phone, or I'm going to start a new hotline bling, and we're going to go from there. All right, y'all. Everybody have a good day. Thanks for tuning in.
Bilal, thanks. All right, Doc.
Thanks, sir.
You'll have a good one. All right, Ty. Thank you.
Thanks, Ty. And so I think it's important that you understand the clinical trial process. not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. I'm the only one still here.